Dr. Kim explains the diagnosis for sleep apnea.
Sleep apnea can be diagnosed by performing an overnight sleep study. Also, your sleep partner can observe some of the symptoms.
In many cases, loud snoring is a sign of sleep apnea, which is a condition that should be taken seriously.
It's like a whole new life for both of us. I know the first time that we came in after he had gotten his appliance the first time, we went home, and he immediately got in his recliner and put the mouthpiece in and took a nap, and he did not snore. I couldn't believe it. I sat on the couch and watched him because I couldn't believe it. And then he just took a little nap, and he got up and he felt better than he had all day. He took like a 15-minute power nap. He felt better than he did all day. So then he started sleeping with this, and he did not snore at night. It was absolutely wonderful.
We asked Bill Swedeen about his experience the next morning.
You know, I get up in the morning, and I've slept, I have a good night's sleep, and I'm ready to go and meet the day. I'm 71, and I'm out there work 6-7 days a week.
Many clinical studies have identified that over 80% of loud snorers suffer from some level of sleep apnea. But is this dangerous?
This can be a serious problem. If you stop breathing often and do not supply enough oxygen to your body, it can cause serious brain and heart-related problems.
It's important to know 12 leading consequences of sleep apnea: cardiovascular complications, high blood pressure, worsening diabetes, daytime sleepiness, morning headaches, unrefreshed feeling in the morning, emotional instability, unclear thinking, chronic fatigue, concentration difficulty, motor vehicle accidents, and a decreased libido. We asked Dr. Kim, once you diagnose the problem, what are the treatment options for sleep apnea?
Basically, there are two effective treatment options. The first one is a CPAP device, a mask which is connected to a small air compressor which supplies air to the lungs through the nostrils. Second option is the oral appliance, which is a small dental mouthpiece, which is custom fabricated or fits on the patient's teeth. This device repositions the jaw and the tongue slightly forward and keeps airway open while you are sleeping. The oral appliance is the best treatment option because it is easy to use, non-invasive, and the best compliance to use it. Furthermore, it is the FDA approved, and also the American Academy of Sleep Medicine, which is the largest governing body in medicine, they approved the oral appliance as a #1 choice for the mild and the moderate sleep apnea, and also who are intolerant to CPAP unit. So they must be the best option.
We asked patient Dr. Philip Littell to compare the CPAP machine that he had used previously to being fitted with the oral appliance.
It is very, very easy. Compared to a CPAP machine, there's no comparison. There's no CPAPs, you have to sterilize the equipment. You have air blowing in your nostrils. This is very, very comfortable for me. I had no problem. I was very sleepy during the day. So I decided to do a sleep study, and that confirmed I had apnea. And then it was fairly mild. And then several years later, I decided to do another sleep apnea test, and it was more severe than the first one. So that's when I decided I should do something about it. So I came in and made an appointment with Dr. Kim. And so he suggested an appliance to be worn on upper and lower teeth. And he said this probably should do the job.
We asked Dr. Littell and Bill Swedeen if Dr. Kim's appliance worked.
Well, it did. I'm very pleased that it did. All my the signs that were monitored are now normal. There's no lapse in breathing. Oxygen levels are normal, and I'm not sleepy during the day.
My wife was constantly complaining that she had to wear earplugs, you know, in order to sleep in the same room. And plus the fact that my sleep apnea was bad enough that I would stop breathing at night, sometimes as long as 45 seconds. And she'd have to give me a nudge and get me going again. And it scared her, you know. She didn't know from night to night if I was going to get up or not. So she finally saw this ad in the paper that said, you know, go see Dr. Kim and they've got something new that'll keep you from snoring. If I quit snoring, it's going to help my sleep apnea. So we came over and they made an appliance for me, and it's like an athletic mouthpiece they put in, and from the first time I put it in, it was unbelievable. I get up fresh. I'd had a good night's sleep, and my wife says, that was wonderful. She said, you didn't make a sound last night. So it worked out really well, and I've had it almost a year. I mean, next week it'll be a year that I've had my appliance. There's never been a night that's gone by since I got it that I haven't worn it.
He just sleeps so well. So do I. We can't say enough about it. It's just been a blessing.